Assalamualaikum and hi guys! Today, we will share with you guys on the oral glucose tolerance test for diabetes mellitus. But first, what is diabetes mellitus? Diabetes mellitus is the most common endocrine disorder in which the blood glucose level is higher than its normal range, or also known as hyperglycemia. It is due to either the pancreas not producing enough insulin or the body cannot effectively use the insulin it produces. There are three common types of diabetes mellitus. Firstly, type 1 diabetes mellitus. It is which also known as autoimmune disease, a condition with lack of insulin production due to the body's immune system attacking insulin-producing islet cells in the pancreas. Next, type 2 diabetes mellitus. It is when there is a resistance of peripheral tissue to insulin action and produce an inadequate amount of insulin. And lastly, gestational diabetes mellitus. It happens during pregnancy and will go away when the baby is born, but the mother may develop type 2 diabetes mellitus in the future. So, what is the lab diagnosis for detecting this diabetes mellitus? The oral glucose tolerance test, OGTT, is the most sensitive test for detecting borderline diabetes mellitus. A glucose tolerance test is the administration of glucose in a controlled and defined environment to determine how quickly it is cleared from the blood. It is indicated by the nature of blood glucose curve following the administration of glucose. Therefore, the test is usually used to diagnose for diabetes mellitus, insulin-resistant and sometimes reactive hypoglycemia. By following a standard oral dose of glucose, plasma and urine glucose levels are monitored at regular intervals in order to measure tolerance under defined condition. Then, for specimen requirement or preparation. Firstly, the patient should be instructed to maintain a normal diet for the days prior to the test. Next, the day before the test, the patient should fast for a period of 8 to 14 hours, but still, plain water is allowed. Furthermore, it is best to conduct testing in the morning between 7 to 9 am. Moreover, testing requires a minimum of 1 ml of blood be drawn. However, it is preferred that 7 ml of specimen be obtained for each draw. Next, as blood will need to be drawn, either wear short sleeve or a top that allows the patient to roll up sleeve easily. And lastly, blood collected in a BSD, SSD or grey top tubes are the specimen of choice. A random urine sample may also be necessary depending on where the patient samples are collected. Now, let us explain about how the OGTT test is performed. The patient will be asked not to drink, eat or take any medications for up to 8 to 14 hours. This test will begin around 7 to 9 am with fasting blood as the beginning sample. Next, the patient need to drink a standardized amount of glucose solution within 5 minutes. The patient needs to continue fasting until the test is completed. However, the patient can drink the water during this test. The venous sample will be taken every 30 minutes until the total specimen needed are collected. The sample must be taken on time and labeled according to the time taken. Lastly, plot the graph with x-axis as the time taken and y-axis as plasma glucose level. Other than blood samples, urine sample can also be used. It will detect the presence of glucose and ketone bodies. The procedure for urine samples are the same as blood samples, but the first sample is random urine sample. As you can see here, this graph shows the blood glucose curve. The 75-gram glucose drink normally elevates blood glucose levels, stimulating the pancreas to produce insulin into the bloodstream. Insulin facilitates the uptake of glucose by cells. The blood glucose level is expected to drop back to normal as time passes. When you don't make enough insulin or your body cell become resistant to insulin, less glucose is carried from the blood into the cells, and your blood glucose level will stay high. A normal blood glucose level is lower than 140 mg per deciliter, while blood glucose level between 140 and 199 mg per deciliter may indicate pre-diabetes or impaired glucose tolerance and may have risk in developing type 2 diabetes or heart disease. Moreover, blood glucose level with 200 mg per deciliter and above indicates that the patient had diabetes. The high blood glucose level may be due to the incapability of the body to produce enough insulin or the body cell are insulin resistant. If the patient shows hyperglycemia, which is the symptom of diabetes, the doctor may perform another blood test or simply repeat the test on the next day to confirm the diagnosis. Okay guys, now you already know that OGTT can be used to diagnose diabetes mellitus, and hopefully this video can give benefits to you guys. Thank you for watching. Bye bye.